Okay, great. Okay, so hello everyone. My name is Miss Sam. I am one of the teen librarians here at the Levittown Public Library, and we are honored for the month of July and August. We're going to be celebrating our first responders, and part of that, we are very honored today to have Bobby Mallimo Jr., who is the captain of the West Islip Fire Department Rescue Squad, and you're going to tell us all about what it's like to be an EMT and be in that field, and we are so honored to have you. So thank you so much for joining us today.
Thank you for having me.
So tell us a little bit about yourself and how you got to where you are and what is it that you currently do?
So I'm the captain of the West Islip Fire Department Rescue Squad, which is an all-volunteer agency. There are some paid EMS providers as well, but I would say about 95% of our members are volunteers. They come down on their own free time. I've been a member of the department for coming on 5 years. And in order to get to captain, you go through lieutenant. Well, you're a general member, then you become a lieutenant, then you become a captain. And that's about a 2-year term. I'm about almost halfway through the my first term. So basically, as a captain, I oversee all the other members and make sure that the ambulance is getting out and then it's getting out efficiently, that everything we need is on the ambulances, as well as obviously driving and being the EMT in the back of the ambulance.
Gotcha. And then can you describe to us a little bit about, we hear the word EMT and then we hear the word paramedic, kind of what the differences are.
Sure.
What you guys do compared to, the other.
Okay, so there are levels to emergency medicine. So there's actually one step below an EMT would be a certified first responder, which out here in Suffolk, they don't recognize. I know they recognize it in the city. Okay. And that's basically, you could do CPR, you can assist on the ambulance. Then there's EMT, which you can treat patients, you can give certain medications, there's certain protocols you have to follow. That takes about a 6 to 8 month course to become an EMT. Then above an EMT, out in Nassau County, there's an AEMT, which is slightly more advanced. That's what the A stands for. And you can do a little bit more with your protocols. Like in the field, you'll be able to start an IV. And if somebody can't breathe, you can intubate them a specific way. And then above an AEMT, there's a paramedic, which basically they have the most things that they can do in the field without calling for a doctor to help. So they can push more medications, they can start that IV, they can, it all boils down to what you're able to do on standing orders is what they call it.
Gotcha. So it's kind of just a different level of training for each kind of level as you go up.
Exactly.
But you're all assisting in the field, you're all assisting on the ambulance and things like that.
Exactly.
Gotcha. So, and then can you tell me, I know you said, a 6 to 8 month course to be able to be an EMT. Can you talk a little bit about like what the training is like? Are there any restrictions as far as like age restrictions or education restrictions in order to go through that process?
Sure. So the EMT course, it varies. There are rapid courses where you could get your whole EMT done in 2 months, but you'd be going 5 days a week. Most of the time when you take an EMT class, it's 2 nights a week, 2 to 3 nights a week for about 2 hours each. And they go over the skills you're going to need to go over, like your trauma assessment skills, your bleeding control, your medical assessment, how to use certain medications, how to administer an EpiPen if that were what you needed to do. There are no education restrictions on it. You can just about anybody can become an EMT. There is you have to be 17 in order to take the test. That was recently changed in New York State. It used to be you had to be 18, but now they opened it up and 17-year-olds can take the class.
Oh, great.
Besides that, there's really no restrictions as far as who you can do. Usually you have to be registered. Well, if you're registered with a fire department or a local ambulance company, you can, some of the departments, most of them will pay for you to go. There's usually a fee to register, but anybody could register. I know Suffolk Community College and I believe Nassau Community College both offer them as well. and you could get them as credit courses. And most of the colleges in New York State, at least the SUNYs, offer them, that you could take it as part of your college load if that were something you were doing.
That's great. And then I know you have briefly mentioned that there's 95% of your team is volunteer, and then there's also career paid EMTs. What are some of the benefits? Obviously, with the career paid, you're getting paid, so we know what the benefit is there. But what are some of the benefits for volunteering? Obviously, there's a lot of good that you're doing in the community, but what other benefits would you say that there are for those who volunteer?
I'd say the biggest benefit is you get to know your fellow volunteers, and it's kind of like a big family as a group. There are, if you're a property owner, there are some tax breaks that you can get as a volunteer as well. But really, it's just that sense of community and getting out and helping your community and the people around you. It also gives you that experience that if you want to, bridge your way into this as a career path, it's a great place to start. Most of our volunteers work in EMS in some capacity. And EMS has, lots and lots of job opportunities as far as, where and when you want to work.
Right.
So it kind of opens that door.
Well, and that actually leads nicely into one of my other questions is about transferable skills. Obviously, when you're going through the EMT course, you're learning a lot of those, life-saving and, beginning, medical services skills and things like that. So obviously those are very transferable into other careers. Can you talk a little bit about what are some of those other careers that you've seen maybe, fellow EMT volunteers move into or, things that those skills would transfer into?
Yes. So being an EMT actually works great with a lot of different careers. Many people come in, they join EMTs because they know they want to go into the medical field, but they're not exactly sure where they want to go. So many of my friends and fellow EMTs have gone in, been an EMT for 2-3 years, and they say, you know what, I want to go to nursing school, and they go to nursing school, or they go to med school, or they go to PA school. But as well as that, it's a great skill to have, if you were looking to go into law enforcement. A lot of law enforcement agencies want you to take an EMT class, at least at the beginning. And it comes across in fields that you wouldn't necessarily think of. It looks really good on a resume as far as other jobs. Like I'm a school teacher during the year. So having that on my resume, if they look and they see, oh, well, you're an EMT, it's something extra that they didn't necessarily think they needed. So it can help in any career, but it's definitely, you see a lot of people using EMT as a stepping stone to kind of step into that medical field.
That's great. Yeah, it's definitely a great way to get started and to, grab some skills and be able to use them into other careers. So that's definitely great. Also, something I wanted to talk about as far as, since you are a volunteer and like you were saying, you do have a daytime job where you are a school teacher. How does the schedule work when, you're volunteering and stuff like that?
As a volunteer, it's pretty easy to do. When you're around, most agencies give out like a pager or they send text to your phone. You see the call go off, you come down to for us, it's to come down to the firehouse. So you get on the ambulance and it's great. Sometimes they will ask you to do certain allotted crew shifts, but you can work with those around your schedule. And then I have worked EMS as a career as well, all through college. And it's pretty easy to work EMS into your schedule and work around EMS because there's not a time of day where EMTs aren't needed. So if overnights work great for you, you can work overnights. If you want to work during the day, you can work during the day. It's kind of a little bit of flexibility in your schedule.
Yeah, no, that's definitely one of the greatest things about the career is that you really can make it work for you, whichever way that is. Can you tell us a little bit when you are on call and when you get the call, what is kind of the typical day? Obviously it changes very much day to day.
Yeah.
But is there anything that you would say that is consistent or anything that, you need to be prepared for each day?
Yeah. So like you said, there really is no typical day for an EMS provider. You could come in, if you're doing an 8-hour tour, you can come in and have nothing for 8 hours and that's great. Or you could come in and you could be running nonstop. I like to think about the time I used to work in Brentwood for their ambulance company, and we had, in the peak of COVID, I believe 29 alarms in an 8-hour shift. But then there were times that you sit there and there'd be absolutely nothing for 16 hours. There's a lot of, I know a lot of people like to go into EMS because they think, oh, we're going to be helping people, and you are. And they think that it's going to be all car accidents and all people falling down and getting hurt. It's not as much that. There's a lot of medical that you have to get into, which is where I enjoy looking at it. It's kind of like putting a puzzle piece together. Oh, okay, they have this complaint and this complaint. We're not necessarily diagnosing in the field, but we need to know, what our next step should be. So you really kind of just have to expect the unexpected, because you never know what you could get. There have been times where they'll call the ambulance for a sick person, and then we get there and it's a mom in labor. So you're talking to people in their most stressful part of their life. So you never really know what to expect. But I'd just say, yeah, expect the unexpected.
Yeah. And then we've been talking about technology a lot lately, obviously with with COVID and stuff. We've been using technology in new ways. Has technology changed your job in any way recently, or do you see any things coming in the future that we should be aware of?
Yeah, there's some, it affects the medical field a little differently. Until about 2 years ago, we used to fill out all our paperwork. We have to fill out paperwork for each run that we do. And we used to fill that out on paper. As of lately, we've been filling them out on a computer. So we actually have a little computer that we bring with us, and we insert all the information, and that can make it easier. Sometimes, like, the computer can save patient information. So if we get somebody who called within 3 months and we just put in their first and last name, it'll pop up with their medications that they take and their allergies and that kind of stuff. That we can't access normally, but it'll just populate in the computer if we've taken them recently. And then as far as even like technology affecting how we can treat patients, we have one device specifically comes to mind. So when you're doing CPR, it can be obviously physically exhausting for the providers that are doing it. We now, over the last few years, have they're becoming more common. It's called a Lucas device, where it will actually do the compressions of CPR for you, so that the EMTs can focus on other things, such as giving them medications and making sure that they're breathing adequately. So like I said, a little different kind of effects of technology, but
yeah. But that's great, because it definitely helps make it easier, and it helps you be able to focus a little bit more on the patients rather than, having to deal with all the paperwork and like you said, not tiring you guys out as much when you're trying to, do other things. So obviously it's a lot at one time. And then would you say that, there are certain times of the year that are busier than others, or is it pretty much steady throughout the year? I mean, obviously it's medical. So I know we talked about, no matter what time of the day it is, it's pretty, could be busy or not.
yeah, it's pretty much consistent through the whole year. You will see a little bit more during the summer of like those car accidents or traumas, because people are outside, they're doing more activities, kids are playing sports, they're going to fall and break their arm. But it doesn't really affect the number of calls necessarily. I would say it's pretty steady through the whole year.
Gotcha. And then I know you talked a little bit about advancement, how you can advance up, how, you've gotten to captain and things like that. Kind of what's the process of moving up through those things? I know you said that there's some time restrictions, and then is there, certain requirements that you need for each level, or is it just based on time and experience and things like that?
Well, I can't speak for every agency, but the way it works in our department is your medical training does not necessarily affect your ability to move up through the ranks. You can, become an EMT, then take your paramedic class and just stay a paramedic, just stay a general member. If being an officer were something you were interested in our department, obviously you can't be like super new. You have to have some experience under your belt. And then typically it's an election for the officers. So you'd run for second lieutenant. Then after 2 years, you can move up to first lieutenant. And after 2 years, then you'd move up to captain. There are some exceptions. You can run for the position above you after a year. So if you did 1 year as second lieutenant, you could run for first, and then 1 year you could run for captain.
Gotcha.
But it's an election, and it moves pretty regularly, so it's never stale.
Gotcha. And then we always talk about, teamwork versus, doing work individually. Obviously, I would think you're, working within an ambulance setting. There's a couple different, people that you need to work with. So could you talk a little bit about that? Is it more, should teens be prepared to be working in teams? Is there any individual work that you do throughout your day? How does that work?
Yeah, you should definitely be prepared to work in teams. There are times where it will just be the EMT and the patient in the back of the ambulance. So that would be somewhat individual. But a lot of the times when you're on scene, you're working with another EMT or a paramedic and the driver and the police officer that's usually on scene. And if there's firemen on scene, like if we're on a motor vehicle accident, firemen are going to be in there basically cutting the car to get the patient out. They could be. So you have to be able to work as a team, but at the same time, you have to be able to work individually and make your second decisions.
Right. Yeah. And then I know you talked about, going through the EMT course, and, that there were different options for that. Are there any licenses that are required to be an EMT? Obviously, you have to pass the test, I know you said, but how does that work?
So it is when you take the class and then you take it's a state exam. Once you take that state exam, you get they call it your EMT card. It's basically your license. You have to refresh that card every 3 years, which there are two options to do that. You can take what they call CMEs, continuing medical education. So you could take a certain amount of classes over that 3-year period, or you could take a refresher class, which is usually a shorter class than the original class, but you go back and it's basically like a review of everything that you would have gone over in your class.
Gotcha.
But besides that, you could get, obviously there's a CPR card, but your EMT license does cover that as well.
Okay, great. And then obviously we talked about, you need to be 17 years old to be able to even take the test. Is there anything that teens now could be doing if they're not quite 17 yet? Are there any internships? Are there any, ride along type programs or anything like that they could be doing now if this is something they were interested in?
I suggest reaching out to your local department. A lot of them offer juniors programs so that until you're 17 and you can join the department, you can come to drills and go over skills. I know some of them, like the junior fire departments, do like racing teams and they compete. And I know some of the junior EMS agencies do, like they call them drills, and they do like medical assessment on fake patients and see who can, assess the best and treat the best as well. So I would definitely say reach out to your local agency, and you could, even start coming down. A lot of them want you to come down a little bit before you join. So even just getting your name out there and speaking to those agencies, there's a lot you could do.
Yeah, it always helps to network, I always say. Yeah, definitely.
Yes.
And then as far as, a teen in school now, are there any subjects that they should be focusing on? Are there some, like, how often do you use math compared to writing, compared to, science and things like that in your daily life?
We basically use most of them. It's not necessarily the traditional route of any of them. We use biology, obviously, as a medical provider. But we also, we need to have good writing skills to write our paperwork up, because we're writing basically a narrative of everything we saw, everything that happened, everything that we did. So you need to be able to clearly emphasize those thoughts, but you're not writing a novel, but you need to be clear in what you're writing.
Right.
And then we also do use math. Paramedics use math a lot more than EMTs do. As far as if they're giving medications, they need to, be able to take a look at the age of the patient and the weight of the patient and how much medication they can give. But as EMTs, we are doing that as well, just not to as extreme of a scale.
Right. Gotcha. And then what would you say is the best part of your job and the biggest challenge?
Best part of my job would say that I get to help all these people. Like, as I've said before, it's a difficult time for them anytime they have to call the ambulance, and just getting to be there and be that person and try and bring them down and help them, and even help the family to calm down as it's a stressful event for everybody who's there. So getting to be there and help them through that, I would say, is the best part. The most challenging part, and there's a lot of challenging parts to EMS, but I could say waking up when you're sitting there and there's an alarm in the middle of the night, that'd probably be one of the most challenging.
I could definitely see that. Yes. Okay. And then I guess my very last question today would just be, do you have any advice, any last minute words of wisdom for a teen that may be considering this as something that they would like to do?
Yeah, get your name out there, get in there early, because that's all the more experience. That's the better provider you can be. And the sooner you're out there and you're getting that experience, the easier it'll be for you to get into the job as a career path, if that's what you choose to do.
Great. Awesome. Well, thank you so much for joining us today. And I cannot tell you how much we appreciate everything that you and your company has done, especially during this last crazy year. I mean, that's just been insane. So thank you so much. And, we truly say thank you. And thank you for joining us today and giving us some inspiration.
Thank you for having me.